Hello, come on in, take a seat. You remember me? Yep, exactly. It is nice to see you. I wish under better circumstances, of course, but hopefully we will be able to take care of any concerns that you have coming in today. Looks like you are my next one to bring back. If you wouldn't mind confirming your first and last name for me. All right. And date of birth, of course. All right, excellent. Let's see, looks like the chief complaint that the girls put in your appointment title was pelvic pain. Would that be correct? All right. So I just have a few questions regarding the pelvic pain. So I could write it for the PA that'll be seeing you today. As far as the pelvic pain goes, how long has it been going on for now? Gotcha. And is it like a dull achiness or more of like a sharp stabbing pain? I understand. And do you find that the pelvic pain only occurs at certain points during the month or only at time of period? What do you think? Okay. And if you were to rate the pain on a scale of 1 to 10, 10 being the worst pain of your life, where would you rate it? Okay. No, yeah, I totally understand that. Does anywhere else in your body hurt you at all? Yeah, whether it be your back, your leg. Okay. Gotcha. All right, and then as far as vaginal concerns, abnormal discharge, odor, itching, burning, like urinary symptoms, burning when you pee, peeing too much. Okay. Gotcha. Okay, so I will leave that for Leanna, the PA, to look over. And then the general usual questions that I ask you through here that are sort of unrelated, but you haven't had any new medical diagnoses since we last saw you that I should add to your medical history at all? Nope. And so any new medication use, any new herbal supplements, anything like that? Nope. And then as far as surgical history, tonsils. Okay. Do you know when that was? Okay. And then family history, no new pertinent cancer history at all. And smoking status, has that changed? And then as far as your sexual history, any new sexual partners since we last saw you, whether they be male, female? Okay. And you are not currently on any hormonal birth control, would that be correct? Gotcha. All right, looks like your last PAP was earlier this year, so we're all good there. You did have recent infection screening, which is good. Okay. And of course, just want to make sure that you feel like you're in a safe environment currently. There hasn't been any physical nor emotional harm. Okay. Let me just complete the history taking here. And then we will get your vital signs going. And then I will prep you in a room. And then Leanna, the PA, will begin. Awesome. All right, are you ready for some vital signs? Gotcha. Now, there is a chance that with pelvic pain, it's super common for Leanna to want to do a pelvic ultrasound, and that could be, abdominal or transvaginal, depending. Is that something that you're okay with today? Okay, I just wanted to make sure. So I'll put that you consent to that today. And of course, do you consent to a pelvic exam with the speculum? And do you consent to any swabs that take place if there's any discharge seen? Okay. All right. are we going to do the usual arm here? Yep, of course I remember. So of course for this part, I'm just not going to be talking at all, just to get a better listen to your heart. Okay. Does that feel secure? Okay. Alrighty. Alright, blood pressure's good. You haven't felt any fevers or anything? Good. Alright, next up is we're going to do a temperature check. I'm just going to put your pulse here. This is just going to go underneath your tongue. Perfect temperature. Awesome. That taken care of here. Alright, so we put a little bit more sanitizer. And what I am going to do, if it's okay with you, is I am just going to give you this cup. If you wouldn't mind just leaving a urine sample in case we do need to send it off. Let me put your name on it. I will keep that over here on the counter. And then once you're done leaving your urine sample, you can make your way to room 2. There's already a drape waiting for you. And then what you'll want to do is just get undressed, waist down. Everything top-wise can stay on, but Leanna, the PA, may want to press on your abdomen. That's okay with you? Awesome. All right, very good. So it was nice seeing you from my end, and Leanna, the PA, will be in shortly, okay? No problem at all. All right. It's nice to see you. I heard you were pretty uncomfortable today. Well, I completely understand that. Lee, the medical assistant, was sort of giving me the rundown as far as the pelvic pain you've been experiencing. Yes, yep, exactly. One thing I did want to ask you is, have you had any changes as far as like loss of appetite, diarrhea, constipation, nausea, vomiting, anything like that? Okay. And just curious, have you seen like a primary care doctor for this reason at all, or you came to us first? So no prior workup as far as labs or anything was ever done? Okay, just wanted to make sure that is no problem at all. So For a full evaluation regarding pelvic pain, one thing I always like to start off with, of course, is a pelvic exam, if that is okay with you. We would take a look on the outside. I'm going to take just a swab to make sure that you're not tender in certain areas of the vulva, and then we'll take a look inside with the speculum just to make sure that there's no signs of infection. And it would probably be smart for us to do an infection screening if we see anything abnormal. I then am going to do a manual exam with my glove, and that's to make sure that I don't feel enlargements, masses, or that you don't have cervical motion tenderness. And then one thing we could do, if it's something you were interested in, is I could always do a new portable ultrasound here. It would be trans-abdominal only, not transvaginal, and we could see if we see any ovarian cysts or anything that could be causing the problem. That works for you? Okay, awesome. So what I'm gonna do is let's just kind of set up our little station here. I'm going to kind of briefly start up the portable ultrasound machine. Let me get everything set up. We've got our gloves. We've got a pair here actually to use. We've got our infection swab and then our other swab there. Small speculum today, you already know. Then we've got some lubricant jelly, portable ultrasound. I'm gonna get that connected to the system here for ya. But first, we're gonna kind of start off with the basics, just a pelvic exam to make sure I don't see anything suspicious on the outside vulva area, okay? Awesome. And of course, as always, you let me know if you get uncomfortable, and then we'll try to do the best that we can as far as making you feel okay. Okay, so you are going to feel my gloves outside here. Just looking on the outside. Again, making sure I don't see any suspicious moles or lesions, that I don't feel swollen lymph nodes at all. I'm going to kind of press here on your belly. Any pain there at all? Okay. We are doing okay there. Just going to press around here as well. But nothing that I can actually physically see. So that is off to a good start there, of course. I am going to take one swab here. I'm just going to kind of poke at different areas, and you let me know if there's any pain. Good. 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 Excellent. Very good. Good. Very good. All right. And then I don't see hemorrhoids, of course. The next part is we will be doing a pelvic exam with the speculum. Probably feel some cold lubricant jelly here. You'll feel my gloves outside. Gonna feel that pressure now inside. You're doing great. Alright, cervix looks healthy. I don't see any polyps. I do see like a little bit of like a thin white discharge. So we're going to do the infection testing here. Okay. Just going to get a good sample here. I am going to take this out now. You're doing okay so far? You're doing absolutely fantastic. Next part here is I'm going to put some lubricant on my gloves. Just want to make sure I don't feel any masses. Okay. Yeah. swabs here. Okay. No tenderness when I do this, right? Good. Okay, very good. I'm going to take that glove out now. I'm going to grab a different one just for the ultrasound. So this is a nice, newly invented portable ultrasound. Normally transvaginal ultrasounds would be most diagnostic and can kind of let us see most detail. But this one is pretty up there as well. So with that being said, we'll go with the transabdominal route today. Let me cover you up here. And then I'm just going to use this area here if that's okay. Let's get this ultrasound kind of started here. Kind of warming it up, if you will. And I just, move this closer. I just want to put your demographics in so that we can, of course, save this report in your chart. And so you're really going to be feeling a lot of pressure on your belly. But like I said, as far as the examination down there, nothing else will be getting inserted vaginally. Okay, just going to put a little bit of jelly here. Perfect. So that should work really well. All right, here comes the portable ultrasound. I'm going to take some pictures kind of as we go along here. Okay. You doing okay? Okay, good. Yeah, I know, super cute and purple. Love that. Was it raining outside when you came in? At least now we can kind of confidently say, you know, that winter is probably done in Michigan. So I could probably put my winter coat away, I think. Okay. We're getting good images here. You in pain at all? You're okay. Good. All right. Let's kind of take it over to the middle. Any history of ovarian cysts at all? You think a few years back? Yeah, you know, you have a very small one here on your right side, about 1.3 centimeters. So there is a little bit of fluid though that I see. So, you know, what's possible is you may have had a larger cyst that ruptured. And I think that's why it kind of ties in with like your history of symptoms. One of the doctors told you just to go on pills. I see. What were your thoughts on that? Oh yeah, it's definitely not something you have to be on. For people who tend to get a lot of ovarian cysts, especially if they get large enough that where it's like surgically indicated, it's not a bad idea because they do help prevent recurrent cyst formation. And they also help in other things regarding periods, like taking pain away, that sort of thing, making them a lot lighter. But, you know, hormonal birth control is not for everyone, and if it's not something you were interested in or you liked, of course, you know, you're never forced to be on anything. It's just more so to help with those cysts, I think, so that you're not having these kind of situations or episodes where they rupture and they are painful, you know. It's kind of like weighing out the pros versus cons of that versus like surgical removal of cysts. But you're just so small, you definitely don't need surgery, and it's likely resolving, meaning that in a week or so, if we were to repeat the scan, probably wouldn't even be there. But you never know. All right. I think we're done with the ultrasound. We got some really good pictures here. You're doing okay? Awesome. So yeah, like I said, just about that 1 centimeter cyst on the right side, a little bit of fluid that may have indicated that one of the cysts ruptured, but nothing on the left ovary. Your uterus looks healthy, no fibroids, no masses, nothing like that. It is good news, absolutely. And I'm sure you're familiar, ovarian cysts are incredibly common, especially in patients within their reproductive years. Our goal is just to make sure that the cyst doesn't look complicated or complex, where we're unsure the origin of that cyst. Our job is to make sure the cyst is not very large, where it's causing you a lot of pain, a lot of distress, disrupting quality of life. In people with your situation, I always say, there is a cyst, but there's nothing you have to do about it right now if you don't want to. What we could do is in a few months, if you're having discomfort or pain on that side, we can always repeat the scan just to see if the cyst is gone, if the cyst grew, because it's definitely something we don't want to ignore. So I'm kind of thinking for you, since you're not too keen on starting birth control or anything like that, we just do expectant management where we keep an eye out for things. You like that? That's totally fine, but always know that something like birth control pills are an option for you if that is something that you're actually interested in. And then, of course, you and I will go through the benefit and risks of being on birth control pills just to make sure you consent and understand to what you are ingesting. And then we'll kind of play it by ear. But I am going to be sure that I print out your ultrasound report for you. I'll give you some information on ovarian cysts. And then, like I said, I want you to contact me, though, if any changes in your symptoms at all. Absolutely, for sure. I'm just happy we have a game plan for you. So with that being said, let me give you some privacy. I'm going to go print you off some patient education. And then you contact me if you need anything from me. I'm going to have the labs get sent out for you. I may actually need a blood draw from you before you go. So I'll have you get dressed and leave. The medical assistant will be in. And then we'll get everything taken care of so that you are at peace. And you know, of course, that we've ruled out all of the scary stuff. Absolutely. It is no problem at all. Okay, I'll have you get dressed.